Hello everyone, welcome to Parent Education module on COVID-19. This educational module is going to cover COVID manifestations in children. I am Dr. Rakshay Shetty. I head the Pediatric Intensive Care Services at Rainbow Children's Hospital, Marathahalli, Bengaluru. So how does the COVID manifest in children? The manifestation could be because of the virus itself, in which case we call it as acute COVID, or the manifestations can appear after some time after acute infection. We call it as post-COVID or MISC. So when you talk about acute COVID, the manifestation because of the virus, for most part, around 90% of them tend to be asymptomatic or mild infection. What does that mean? Majority of them would not have any symptoms. In a small percentage of children though, they can have symptoms, and a really small percentage would need a hospital admission, of which very few land up in ICU. Our own experience at Rainbow Children's Hospital, we've had 305 admissions happening to the ward in the second wave. And a huge number of them have been consulted on outpatient basis. What we learned from them is majority of them present with a short duration of fever. Some of them have symptoms very similar to like flu-like illness with cough and cold, and some like stomach flu in the form of vomiting or loose motions. What we noticed is many of them needed a ward admission to 2 to 3 days and treatment for this illness in the form of management of loose motions or management of fever. In a small percentage of children, young children, they manifest with febrile seizures. So very small percentage of children need hospital admission. And the reason for hospital admission tends to be that they either present with loose motions, poor feeding, or sometimes occasionally as febrile fits. So these need simple treatment in the hospital, and majority of them would not stay more than 3 to 4 days. However, having said that, we've had around 20 children with acute COVID getting admitted to ICU, of which 14 of them had pneumonia. Now pneumonia in children, thankfully, is less severe compared to what we see in adults. What we know in adults is the pneumonia presents in the second week of illness in the form of recurrence of fever, cough, decreasing saturation. And thankfully, what we see in children, majority of the times it happens in first week. And it happens in children who are less than 1 year or more than 12 years. Generally speaking, healthy children do escape manifestations of pneumonia. In children with comorbidities, like those children who have developmental problems, who have neurological problems, who have cardiac or renal problems, can have manifestations similar to we see in adults. In children who are more than 12 years, children particularly who are overweight seem to be affected with pneumonia. But thankfully, this pneumonia, whatever we have noticed, all of them who have gone on ventilator have survived and gone home. So it's important to note that the disease behaves very differently in children compared to adults. You don't need drugs like remdesivir and medications which many of the adults do take for acute COVID. You don't need tests like CRP, D-dimer to be done on a regular basis, or a CT scan for that matter. We do it in adults. Those are not required in children. Majority of these children are asymptomatic, and majority of the children, even if they fall sick, seem to have a very good outcome, and a very small fraction of those children, especially those comorbidities, might land up in ICU, and thankfully even they tend to do well. So in short, I would just summarize this module on acute COVID in children to say that more than 90% tend to be asymptomatic, a small percent of children do need hospital admission, and majority of the times it tends to be like flu-like symptoms, either a respiratory flu or a stomach flu, and oftentimes it needs symptomatic management in the hospital for 3 to 4 days. A very small percentage of children, less than 1 year or more than 12 years, if they are obese or if they have comorbidities, can have pneumonia like in adults.